Oh, I don't think I can do this. Okay. Anxiety. Anxiety is one of the most common mental illnesses in America. It is very common, and I'm pretty sure most of you know basically what it is. Your palms get sweaty, you get nervous, you have increased blood pressure, and you guys basically know what it is, but I would like to talk more in depth about it because we go through anxiety every day being college students, such as today. I'm going through anxiety right now because I'm presenting a speech to all of you guys who don't really know me, so that's kind of scary. So I will discuss what anxiety is, how to diagnose it, and what causes it, and also how to treat it. So according to the American Psychological Association, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Not only is there just regular anxiety like increased blood pressure and getting nervous, there's also, you can have OCD, phobias, panic attacks, and PTSD. OCD is basically anxiety that takes the form of obsessions and compulsions. And also there's phobias, so I know many of you guys are scared of like spiders or heights, and that's usually a fear that's not really dangerous to yourself, so that's why it's considered a phobia. And also panic attacks and PTSD, which is anxiety after a terrifying or traumatic experience, such as when people come back from the army, they are like scared of like loud noises and other things because of the terrifying experiences that they went through. And so according to ADAA.org, which is Anxiety and Depression Association of America, anxiety disorders are the most common mental illness in the US, affecting 40 million adults, which basically equals out to 18% of the population. And also females are 60% more likely to suffer from an anxiety disorder, and also the ages of 30 to 44. And most likely that is due because when you're between the ages of 30 and 44, you have a lot more problems. So like divorce, you have to worry about your children, and paying bills and other things like that. And so now that I've talked about what anxiety is, I would like to talk about how to diagnose it and what causes it. So genes play a huge role in getting anxiety, or developing anxiety, and also if you have very low self-esteem, if you're very negative, and also just the way you think about things. So say you have like a very poor, like negative outlook on life, you're gonna have a greater chance of getting anxiety. And also the number one cause of anxiety is our COM 150 class. Just kidding, it's stress. So events such as death, divorce, work and school deadlines can increase your stress levels, which also increase your anxiety levels. And so the symptoms include increased heart rate, sweating, shaking, shortness of breath, which I'm experiencing from right now, and nausea, dizzy, or feeling faint. After this, some of you may think you have anxiety, and most likely you experience anxiety every day, but there's an anxiety that isn't so normal. So if you think that your anxiety is interfering with your work, school, work, relationships, if you feel depressed or have alcohol and drug problems, or you have suicidal thoughts, it is recommended to see a doctor because your anxiety levels are way too high and you need to get help for that. So after talking about how to diagnose anxiety and its causes, I would like to discuss how to manage anxiety. First is to limit alcohol and caffeine, because caffeine is a stimulant and it also increases your stress. Also exercise daily and jog, because being physically active maintains a healthy mind. It releases brain chemicals that provide relaxation and improve mood. It also decreases stress hormone in the body, and it relaxes the muscles so you can have better sleep. And when you have better sleep, you can deal with your anxiety better as well, and stress. And also be positive, take deep breaths, and do your best, especially while performing. Another way to decrease anxiety is by medication, such as Xanax, antidepressants, and Valium. These will not cure anxiety, but it can keep it under control. But one thing is, it can cause dependency. So I know a lot of people also can cure anxiety through therapy. And so, according to the National Institute of Mental Health, despite its high level of treatability through therapy and medication, 2/3 of adults with anxiety do not receive treatment, and teenagers with anxiety receive even less treatment, even less frequently. Only 1 in 5 sufferers do. So after talking about anxiety, how to diagnose it, I would like to conclude. Now I hope all of you have a better understanding of what anxiety is, how to diagnose if it is dangerous to your health, how to treat it, and what causes it, which is usually stress. Although anxiety doesn't seem like a big deal, it can lead to bigger problems physically and mentally. And by defining it, stating its causes, treatment information can help you in performing. And also, I would just like to say, this is only 5 to 7 minutes of your entire life. Yeah.